is Paul at the Garland County Library in Hot Springs, and I want to welcome back our Garland County Health Officer, Shelby. I had been hosting Dr. Shelby to give us regular COVID-19 reports and Q&A sessions throughout last fall and winter, and as it looked like the state of the pandemic was improving, we took a break from that, but sadly that is obviously no longer the case. Garland County and the whole state of Arkansas is experiencing a surge in numbers, so we are bringing these reports back. And in addition to today, Dr. Shelby will give a follow-up report to this one on Wednesday, August 18th, and we will add more in September as necessary. So Dr. Shelby is going to start us off with the detailed status report and then answer any questions you viewers may have about the Delta variant, hospitalizations, vaccines, and so on. So welcome, Dr. Shelby. You take all the time you need, and I'll see you for questions here in a minute.
In the library, facilitating this session. As Paul said, I'm the Garland County Health Officer, and to kind of give a little background, it's a volunteer position that work with the local health unit as well as the state health department in Little Rock. And I've been doing it for a long time, but obviously with the pandemic, it's been a lot more involved. And the main job of the health officer is to try to keep people informed about serious health issues. And we are obviously in the pandemic that this is a very serious health issue, and I hope to be able to kind of get people up to speed and also some of my observation of where we are and where we're going, and certainly answer some questions. What we have done here in Garland County back in March of last year, we formed a task force that made up of the leaders such as the county judge, the city manager, as well as first responders, the LifeNet, and the police chief and the fire chief. And we added members to our task force as the time's gone on. And now we also include the school superintendents of the 7 school districts in Garland County. We generally meet by a Zoom meeting on Monday morning, most Monday mornings, and I give a report, and then we kind of see where we stand and look at things we can do to improve our response to the pandemic here in Garland County. As Paul said, the last session we had here was in April, and it was a different world back in April. I track our numbers here in Garland County on a weekly basis as part of my report that I give to the task force. And I was just looking back at some of our numbers here in Garland County in mid-April, and it seems like a long time ago in time, but in numbers it's a totally different picture. I was looking at the week ending on April 18th in Garland County. We had 16 positive cases for the whole week, and our positivity rate was 1.6%, and we had 22 active cases. And to give you an example of how things have changed, as my report that I gave to our task force on this past Monday, we for the week ending Monday, we had 570 new cases, which works out to 81 new positive cases per day in Garland County. Our positivity rate, which I mentioned in April, was about 2%. Has been running about 18% of the tests that are being done are positive for the coronavirus. Our active cases was at 770, which is obviously a huge difference from April, but it's also a huge difference from just 6 weeks ago. 6 weeks ago, we had 63 active cases, and like I say, we had 770 this past Monday. So that's about over a tenfold increase in the amount of active virus cases in Garland County. So we're obviously in a whole new phase of the pandemic, and have some marked challenges ahead. One of the things that has occurred, certainly in the last 6 or 8 months, has been the amazing development of the vaccines against the COVID-19 virus. And it's very remarkable and amazing and miraculously that these vaccines were able to be developed and mass produced in such a fast manner, but at the same time in a very safe way of developing these vaccines, and they've been tested before they were released, and then continue to be monitored very closely for side effects as well as efficiency. And they continue to show a remarkable amount of efficiency, mainly in keeping people from having to be hospitalized with the COVID-19, and certainly from dying from it. So the vaccines have been available, and probably one of the more disappointing things that we're experiencing now is the lack of people taking the vaccines. So we find ourselves here in Arkansas, in this part of the country, as one of the least vaccinated areas, and also as a response to that, we were one of the most highly infected areas. We're seeing more and more people that they are getting sick and having to be in the hospital on ventilators, and we're starting to see a buildup of deaths that we were seeing back in January and February, and then because in March and April we had very few deaths. We went some weeks, we went 3 or 4 weeks at a time without having a single death, whereas in this past week we've had 7 recorded deaths just here in Garland County. So that's kind of a broad overview of what the situation is. I want to speak a little bit about the Delta variant. It's something that has become, a major concern in the country, and certainly in Arkansas. It's estimated that 90% of the cases that we're seeing in Arkansas now constitute the Delta variant. It's hard to have a real specific number on that because we don't have the capability in Arkansas to really test the samples for the different variants. The samples are collected in Arkansas and sent to the CDC, and as a sample, and so we're able to extrapolate the high percentage of the Delta variant here in Arkansas. And one of the really troublesome or kind of really key things about the Delta variant is the fact that it is so much more contagious than the original COVID-19 virus. The original virus that came out was about, one person would on average give it to about 2.5 people, whereas like the seasonal flu, on average, a person with the flu will give it to one other person. But the Delta variant, because it is so contagious, on average, one person will give it to 8 more people. So that's why we're seeing the really explosive growth in the number of cases that we're having. So I think that's an overview. I think we've got a number of questions, so I think I'll just go ahead and we'll answer the questions, and then maybe follow up with some other statistics that might be of interest.
Yes, thank you, Dr. Shelby. We did receive quite a few questions over email, and then if everyone watching live, you have plenty of time to comment questions, so please get those in. So first of all, a lot of our questions have to do with schools, so why don't we begin with that? What is the current status of our local schools and their plans as the school year starts?
Well, at our task force meeting on Monday, we did have the superintendents online, and and they've been planning for a number of months to get ready for the school year, but they realize that they have some real serious challenges. They just received the guidance from the Arkansas Department of Education, I think within about the last 10 days, on things that they can do to mitigate the spread of the virus. And of course, most of the superintendents were very much hoping that the legislature would give them the opportunity to mandate masks, which is such an important public health tool to kind of help prevent the spread. And unfortunately, the legislature did not pass that amendment to the Act 1002. So the mask mandate that includes schools is no longer an option. Though just this afternoon, there's news coming out that the Circuit Judge Fox, I believe, in Little Rock, has put a stay on the enforcement of the rule against mask mandates until they can have a trial and kind of look at to see if the governor and the legislature have the authority to enforce that. So I think that's kind of up in the air. So, but I think probably most schools, they're scrambling to do what they can. They're really focusing on trying to get as many of the faculty and staff vaccinated as possible, and they've been working on that ever since the vaccine was open to the educators back. I think it was probably in February, and I think they've had varying degrees of getting their faculty and staff vaccinated. And I know Sean Cook at the Lakeside, I think he's got up to like 85% of his staff and faculty have been vaccinated. I think others are kind of struggling to kind of get those high numbers, but that's certainly in terms of providing a safe environment for the kids. Having vaccinated staff, I think, is very, very important. There are also a lot of efforts to vaccinate the students that are eligible for vaccine, which is those 12 and above. And I don't really know how successful they are. I know that in the newspaper today, Dr. Nehus at the Hot Springs School District, was having a really, really good program that they were announcing, where there would be incentives for not only faculty and staff, but also for the students to get vaccinated. And I know that I think all the school districts have had some vaccination clinics, so they're really promoting vaccines as much as they can. And that's going to be such an important part of a safe school environment. But as we know, there are going to be a lot of unvaccinated students, and so that we had the advantage last school year of being able to mandate masks. Those masks have been shown to be highly effective in preventing the spread of these respiratory viruses, and that's going to be one tool that they won't have. And they'll certainly still be encouraging the use of masks, but they weren't really optimistic about how well was going to work. That they're fearful that because they won't know the vaccination status necessarily of the students, so they really won't be able to segregate vaccinated and non-vaccinated students. And so there's such huge potential for spread of the virus in the close environment that schools are just the way that they're run. They're going, but they're certainly going to have. They've done a lot of work over the summer to clean the classrooms. I think they've all put in better, improved ventilation systems, and so they're going to work hard as best they can. I think they're all very, very fearful of just having a few cases a close school environment, because the quarantine regulations are still in place, and that so that as happened last year, you have one positive case in a classroom, and you'll end up having to quarantine you quarantine the rest of the class for up to 10 days, and so that's very disruptive. So, and then if the instructors test positive, that they won't be able to teach in the classroom, so they're all having contingencies to be able to do the virtual instructions, which they got somewhat used to last year, but I think it's probably universally realized and shown that the kids do so much better in terms of learning and socialization in the classroom situation. So that I think that certainly the goal is to do as much as in-person education as possible. But again, we're dealing with this this pandemic, and that's going to really make their job a whole lot harder. And I mean, there are parts of the guidelines is that it will actually have to shut the school down based upon the number of active cases that they have. And I'll kind of mention one thing that's real bothersome to me and to a lot of people with the Delta variant, is that it really seems to affect younger people a whole lot more than the original COVID-19. That there are more people, younger people, 20s, 30s, and 40s, and even in children that can become seriously ill and die from COVID, and then of course the kids under age of 12 are not eligible for the vaccine at this point, so they're especially vulnerable to catching the virus. And I've heard stories, I don't have any numbers, but that Children's Hospital in Little Rock has got many very, very ill children, and I think they've had some deaths from COVID, and it really seems like that's accelerating. So definitely schools I think has the potential to really be really hot spots, and they're definitely working to do everything they can to make it a safe environment.
That actually covers my next question. And just we're having some feedback here. Would you mind turning your volume down just a little bit, please?
Okay.
We're on opposite ends of the same room, but it's still. Thank you.
Okay.
So that was one of my next questions. We've seen some tragic reports lately on how the Arkansas Children's Hospital has reported a record number of COVID hospitalizations in kids. What is it that makes the Delta variant so much more transmissible among younger people?
Well, I mean, it's transmissible to anybody. I'm not really sure exactly why that it affects the younger people a lot more so than the original COVID-19 virus. That's one of the kind of scary, difficult things with these respiratory viruses. And a lot of viruses, they mutate, and that's a kind of normal process, and they become different viruses in some ways. And what happens, a mutation will occur, and then because it's more transmissible and causes more severe illness, and that's one of the reasons why it is more transmissible, it becomes the predominant strain in the community. It's kind of the survival of the fittest, because that's what's more transmitted, so that the people that contract the Delta variant are making millions and millions of copies of it and spread it on. And I'm not sure exactly why it seems to be more serious to children than the original, but it's certainly showing that to be the case.
How do the symptoms of the Delta variant compare to earlier forms of COVID?
Well, they're a little bit different. They tend to a lot of people don't really have necessarily a fever initially with it. Sometimes it's just a sore throat and and maybe a little bit of a cough. Yeah, again, just like in any respiratory virus, there is a spectrum of symptoms, but it's a little bit different than the regular COVID-19. But there's a lot of overlap too, and then it really depends on the severity. That's one of the things about the COVID-19 virus that has allowed it to spread so much is you have so many cases of asymptomatic people that have the infection but are not sick from it, so that they're able to spread it to other people because they don't know they have it, and then you kind of get back to things like the mask and social distancing that helps prevent the spread, especially amongst asymptomatic people.
I've seen some reports that the Delta variant doesn't seem to affect taste and smell or cause a loss. Does that seem to be accurate?
I've heard some reports like that. I really don't have any really kind of numbers to go along with that, but yeah, I've heard that is not as common as it is in the original virus.
What is the latest guidance on when you should get tested?
Well, I think that there's so much, I can remember back, say, a year ago, when people were so anxious to get tested, and we had really limited testing capability. But now the testing is very widespread. Certainly at our Garland County Health Unit, they're doing testing Monday through Friday from, I think, about 9 o'clock to 4 o'clock, and it's a simple procedure. It doesn't cost anything. They generally do the the rapid antigen test, and if that's positive, that's really definitive. If it's negative, then we'll go ahead and send the specimen to Little Rock to do the PCR. So I would tell anybody, if you even have any kind of suspicion that you've been around somebody positive, I would get tested. I would say even if you just had kind of very mild symptoms, because unfortunately, these respiratory symptoms are very, a lot of overlap from just kind of seasonal allergy type things. So I would have a kind of a low threshold for getting tested if there's any kind of concerns, either from who you've been around, or certainly if you have any symptoms. And like I say, a lot of pharmacies are doing testing, doctors' offices, so it's not hard at all to get the test if you have any inkling that you might benefit from it.
And just as a reminder to the viewers, the Garland County Health Unit is right next door to the library, and their address is 1425 Malvern Avenue.
Right. And if you're really looking for a complete listing of testing as well as vaccinations in the county, the City of Hot Springs website, which I think it's cityhs.net, has an up-to-date and very comprehensive guide of where to get tested and where to get vaccinations here in Garland County.
And what are the latest guidelines on quarantining if you've been exposed to someone who's positive, but you aren't feeling symptoms yourself?
Well, the quarantine is that if you've been fully vaccinated and you have been in contact with somebody that's tested positive, that you don't have to quarantine. Though the original CDC guidelines for people that were fully vaccinated, they weren't recommended to wear a mask. But now that we've seen so many people that have breakthrough infections with the Delta variant, it's still recommended that even fully vaccinated people should wear a mask if they're indoors and around other people. So that's really the kind of change in the CDC guidelines. But and also, if you want to, this is mainly for people who are asymptomatic. If you have symptoms, you need to quarantine.
Do we have any stats on the number of breakthrough cases in vaccinated people?
The last I heard from the Arkansas Department of Health was about 12% of the positive tests coming out, and I just assume most of them are Delta variant. About 12% of them are fully vaccinated people, and it also, most of the information at this point is that the fully vaccinated people that do contract the COVID-19 don't get as sick and don't have to be hospitalized and don't have to be on respirators. Though I think that at least I've heard some anecdotal cases where people that have been fully vaccinated have gotten severe illness. So I think this is kind of a moving target at this point, because this is kind of a new development. I know one study came out about a week or two ago to kind of really prove that the asymptomatic people that have the COVID virus or they're positive can spread it. But they did a study where they checked the viral load on people with the COVID-19 that were symptomatic and asymptomatic, and the viral load in the in the nose and the upper throat was the same. So that kind of the conclusion that if they have that much virus in their upper respiratory tract, that they can spread it whether they've been vaccinated or not.
Okay, I'm going to move on to some viewer questions, starting with the ones through email. I received quite a few of those in advance. And then after that, we'll move on to the ones over Facebook and YouTube. So anyone watching live on Facebook and YouTube, you still have plenty of time to get those in. But our first emailed question was, will there be a vaccine booster shot?
Well, that's something that's being looked at real closely right now. And at this point, there's no recommendation for booster shots, and really hasn't been approved for that. But it's something that's being looked at real closely, and I think that there'll be some guidance that'll be coming out in the next few weeks. I've had conversations with a person that had an organ transplant, so they are on medication to kind of cut down on their immune system, and their transplant doctor from Texas recommended they get the booster doses, but they can't get it because it hasn't been approved for that. But I think that the people that are severely immune compromised, the booster that'll be the first group that will be authorized to get the booster. But I know that they're working hard on kind of getting some guidelines, so I expect it to come out soon. But right at this point, there's no recommendations for booster shots, and for I think for average people, the vaccine is shown to be so effective that it's the level of confidence that the vaccine is still working for months, that for average people, they probably won't need a booster anytime soon.
This next emailed question is kind of a two-parter. Is the vaccine genetically modified, and when will the FDA approve the vaccine, or will it be approved?
Yeah, it's still got an emergency use authorization, which is, they had to go through some, really kind of extensive testing before the FDA would give the emergency use vaccine. So it's not like it hadn't been tested or anything like that. But as far as it, kind of modifying, DNA, which some people are kind of concerned about. I mean, the technology for them to make this messenger RNA that does enter some of the white blood cells that makes antibodies, and it kind of gives a little blueprint for that particular cell to make antibodies. But these types of white blood cells, they normally kind of die their natural death in the bloodstream over 2 or 3 days. So it doesn't have any effect on an individual's DNA. It just kind of directs that particular cell to make these antibodies, and it's pretty amazing technology that was initially developed back 5 or 6 years ago when they were looking at a vaccine against the Ebola virus, and it they did tests, and it showed to be effective, and with really no significant long-term effects. So this particular type of vaccine has been around for several years, but as far as getting full authorization, I suspect that sometime with this fall that it will get full authorization. They have kind of really stringent timeframes on in studies that have to be done to get the full use registration. But I think I foresee that coming sometime this fall.
Our next email had a few questions. Her first one was, if you have had COVID, are you immune to this variant?
No, all the studies show you do have some antibodies to the COVID, but it's real variable. Some people that have had COVID will just have a small amount of antibodies. Other people, especially ones that have been extremely ill with it, will have more antibodies. But compared to the antibody response that you get from the vaccine, it really pales in comparison to that. So the recommendation is that the fact that you've had COVID is no reason not to get the vaccine. The vaccine really provides a known long-term robust response to the virus, and there are just so many variabilities in the response to people that have had the COVID virus.
And her second question was, what % of hospitalized patients have had COVID?
The numbers that I've seen lately is that essentially it's 95 to 98% of the people in the hospital that have COVID are unvaccinated. So you've got 2 or 3% of the hospitalized patients have been fully vaccinated, though that's something that's being watched real closely because I think some reports coming out show a higher percentage that with the Delta variant, and so that's definitely some concern. Which is, kind of it brings back the importance that for even people that have been fully vaccinated, the importance of masks. I personally, if I'm in a room with people that I don't know their vaccination status, and if I'm going to be there certainly for an extended period of time, I'll certainly wear a mask because, I'm healthy, but I don't want to get COVID in any shape, form, or fashion.
And then her next question was, get back to that. Are we at the peak of this crisis, and what is herd immunity, and how as a community do we get to herd immunity?
Well, I don't think we're at the peak. I'm looking at our Garland County numbers. We were as far as our number of active cases for about 3 or 4 weeks, we were doubling almost a weekly basis. I think we may have kind of leveled off some, but we've leveled off some at a higher amount of virus in the community, which again, with the Delta variant being so contagious, we're a long ways from being out of the woods. I mean, we're still getting 70 or 80 new positive cases per day here in Garland County. Let's see, what was the rest of the question? I'm sorry.
She asked, what is herd immunity, and how as a community?
Well, herd immunity, I think people are generally considered 60, 70, or 80%. I don't think that there's really kind of a hard and fast rule on that. The only thing I would say that we're a long ways from herd immunity if we ever get there. I think that maybe in some, some countries are a lot more stringent about requiring vaccinations, and they're getting 80-90% of their population vaccinated. So I think potentially they could get to the point where they might see sporadic cases, but with our low vaccination numbers, even though we're seeing some improvement of that, I think that we're going to be living with COVID-19 for years.
And we received another email with a few questions from a concerned parent who wants to know, in your opinion, what is going to happen when schools reopen?
Well, it's going to be a very tenuous situation, and I would certainly be concerned about the kids that don't have, they can't get vaccinated, the ones under 12 years old. I think that it's going to be a lot of protocols and concerns that I know the school district is doing all that they can to make for a safe environment, but with this deadly respiratory virus, it's going to be hard. So again, I would certainly strongly urge the use of masks in schools, and I think the leadership of the school boards, and as well as the administrative people and the faculty in the schools will encourage the use of masks. But I think that's definitely one thing, and as well as trying just to be safe. You don't want to have a whole bunch of kids without mask in a car, are doing things that teenagers do. So I think it's going to be important to be as cautious and vigilant as it can be, because we're going to be living with this certainly for this school year.
And then another question in her email was, in your opinion, should businesses limit the number of customers as was done last year?
I think that would be a good idea. I think that it's definitely spread when you've got several people in an enclosed area. I think their hands are a little bit tied, since we don't have and won't have any kind of mask mandate. So wearing a mask is going to be voluntary. I've encouraged businesses to be pretty forceful in their signage, and kind of explaining that if you come in to our place of business and you haven't been vaccinated, the recommendation, our recommendation, is that you wear a mask. Again, it's not something that's enforceable by law. It's just a good practice, good recommendation, but I think should be firm that this particular business wants to keep everybody safe, and do that by keeping people masked.
And there's a final question over email that I think is pretty interesting, behind the scenes question. Are you or have you been asked for your input regarding this new COVID crisis? And if so, what input have you shared with the governor or legislature and such?
Well, I haven't had any conversation with the governor, though I have talked to my state senator and state representative about especially getting ready for the special session that they had, and I know that they're very concerned about it, and it's unfortunately so much of the whole pandemic has become, and certainly the vaccinations has become politicized so much, but all the state leaders that I've had personal contact with are very, very much encouraging all their constituents and friends and family to get vaccinated for sure, because that's really the ultimate solution to this, and so it's trying to get as many people to kind of pass the word that vaccinations are crucial.
I have a question from Adam, who says, ask Dr. Shelby if he thinks the city of Hot Springs or Garland County will reinstate a mask mandate due to today's ruling by Judge Tim Fox.
I haven't heard of any discussion about that. They'll probably be watching the kind of the outcome of this litigation for some guidance. I know that some of the city leaders would really like to have a mask mandate, at least in the city offices, because for one thing, they've over the last year, they've had to shut down some departments within the city government because one or two people tested positive, and they work in close contact. So everyone in that department has to quarantine, and really puts a crimp in providing essential services. And so that as far as some of the local leaders, I mean, they would welcome to have the authority to do that, because you've got people working in a close environment, but also working with the public, people that they're coming and going, and so they're really worried about the effects it will have on the city and county employees and their ability to do the vital functions that make the community work.
We have a comment from Karen who says, a state senator has posted that 46 children have died due to getting the vaccine. He reported that his information is from Vaccine Adverse Event Reporting System. Do you have any comment on this? Or are you familiar with this?
No, I'm not familiar with it. I've not heard anything about that report. I know, Dr. Romero, we're lucky to have him as our Secretary of Health. He's a pediatric infectious disease specialist with a wide knowledge and background in vaccines. I think that if he would be the one that would be knowledgeable of findings such as this, and his responsibility would be to report it, and he hasn't. So I would trust his reporting over really anybody else in Arkansas.
And do you want to take that comment as an opportunity to talk about the safety of vaccines, since there seems to be a lot of concerns among the public?
Yeah, I mean, the vaccines, they started being available in Arkansas in December, and then very widely available in February and March, and just our state, I think there's been maybe 1.5 million doses given, maybe even more than that. And in the United States, we've had, over 350 million doses given, and they're watching for side effects, and really, the indications or contraindications for the vaccine have not changed since they came out with. They're really only strong contraindications for getting the vaccine is that if you've had an anaphylactic allergic reaction to a vaccine in the past, that you shouldn't get this. And that, to my knowledge, that's still the only hard and fast contraindication for getting the vaccine. And with that many doses being given, if there were any other bad side effects or side effects, that they would have changed the instructions for the vaccines, and they haven't. So that, to me, that's really good evidence that the vaccines have minimal side effects. Certainly, some people get soreness at the injection site. Some people develop a fever. Some people develop some fatigue. But I think universally, those types of side effects clear up in a day or two. And maybe for some people it'll last a little bit longer. But as far as a serious reaction, even a serious reaction that has resulted in hospitalization, I've personally not heard of any of those in our community or in the state, and they may have. And when you're dealing with numbers that big, people are going to have other things going on too, and without studying it, you really can't say that the vaccine caused that. I had a radio show, and someone called in, and that they knew somebody that had died a week after they got the vaccine, but there was no way to, based on one case, to say that the vaccine is what killed them. That's what these big multi-state studies are about, because you have a background of people dying of heart attacks and strokes and pneumonia all the time, and as to whether it has any relationship to the vaccine, to my knowledge, it really hasn't.
What is the health department doing to help educate the public on vaccine safety and combat misinformation?
Well, I think there's a big push in lots of areas of government, but I think that they're trying to get the word out. I know that the health department is doing public service announcements. They doing vaccination clinics, and certainly even in individual physicians. And I know that at our meeting, the representatives from National Park Medical Center shared that Dr. English has done a video that's available on their website, talking about the vaccine, the potential side effects and the importance of it. I think Dr. Hale has done one also. So there's a big push within the medical community to try to get people to understand, and if they have questions and concerns, and it's normal for people to have questions and concerns, but they're people. And there's credible information available in a lot of different sources. And I think one of the things that we do is to ask your doctor about it. Somebody that you trust and trust their judgment. I think that can be highly effective. And if you have anxiety or nervousness about to get the vaccine, I think any physician would be happy to try to educate you on the advantages and disadvantages of getting vaccinated.
And just to confirm, once you are positive with COVID or hospitalized, it's too late to get a vaccine, correct?
No. You can still be vaccinated, and it's still indicated. The only group that have to wait to get the vaccine is that have a treatment called the monoclonal antibody infusion that is given to people. They have certain criteria that have mild to moderate symptoms. I think it's either people with comorbidities or people over 65 that can get this monoclonal antibody infusion, and it's shown to be effective in preventing people from progressing and being ill enough to have to be in the hospital. People that get that have to wait 90 days until after they've had it before they can get the vaccine. But that's the only group that I'm aware of that the vaccine is not recommended for.
To clarify, the question was if you currently have COVID or hospitalized with it, the vaccine isn't going to help.
No, it's really 2 weeks. Most of the vaccine regimens are 2 doses, and you're not considered fully vaccinated until 2 weeks after your second dose. So, yeah, it might. It hadn't been studied whether it'll help if you're only partially vaccinated, but definitely, if you get your vaccine today, you're still vulnerable.
I have a question on Facebook from Jessica. Her question is, what advice do you have to parents with children under 12 who have not yet been vaccinated and going back to in-person school whose staff is only 66% vaccinated?
I would be very cautious. I would really talk to the school administration and express your concerns. One of the school superintendents said if they can't mandate vaccinations for their faculty, but they don't have any problem with the parents asking the teachers, say, have you been vaccinated? And if they don't say yes, you can take it as a no. And I think that's information that if I were a parent, I would be asking that question for sure.
Question from Kay: is there a charge for testing at pharmacies and doctors' offices?
I think that there may be, but I don't have the direct information on that. But I do know that at the Garland County Health Unit, they're doing testing, and there's no charge there. What they recommend doing is calling ahead, and they get some information from you, and then you don't have to get out of your car. They'll come out and collect the sample, and like I say, I know that's no cost at all.
Question from Linda: when do you see booster shots being available?
I think probably for some specific groups, probably within the next month or two. Again, I think the people that are super vulnerable, or people that are immune compromised, such as the transplant patients, I think that's going to be the first group. There may be some other groups, but as far as a widespread recommendations for it, I don't see that coming in really anytime soon.
There's a comment from Eras that Moderna has made a statement that they will have a booster ready by September.
Well, I think they'll have it ready, but I don't know that it's going to be recommended by the CDC at that point. There's so many unvaccinated people in the country, and certainly in the state, that's really the big push now, more so than the booster. But it's going to be looked at, and I think for certain populations it'll be recommended.
I have a couple questions from Tony. The first one is, can you verify if the vaccines contain a live virus or not?
They do not contain a live virus. It's genetic material, but there is absolutely no way that you can become infected from it, because it's not an organism. Sometimes discussing the vaccine hesitancy, and I tell people, I've been around for a long time, and I can remember when they first came out with the polio vaccine, and the people were clamoring to get it because they'd seen kids have polio, and so as soon as it was available, parents made sure their kids got it, and it's highly effective. We see, I don't know the last time we've seen the case of polio in the United States, but that was actually a live weakened virus. So you could actually get polio from that. So that vaccine was highly promoted, and it worked well, but you could get virus from it, but there's no way to get it from the vaccines that we have now.
The second part of Tony's question, vaccine shedding has been a common talking point lately, accusing vaccinated people of causing symptoms and spreading it to the unvaccinated. Is there any truth to this?
Yeah, I mean, it's one. I was listening to a report just this week that the CDC really changed their recommendations as far as mask wearing for vaccinated people very quickly, and because usually it takes a long time to get a change in their recommendation. But it was based upon an occurrence in Providence, Massachusetts, where there was a large group of people, all of whom were vaccinated, and it turned out they did get a lot of spread of the virus, and that was very well documented. So it definitely occurs for sure.
He was referring to vaccine shedding, meaning something caused by the vaccine itself.
No, the vaccine doesn't shed anything. It stimulates your immune response, but there's no virus involved in it. The vaccine, it causes your body to make antibodies against these protein spikes that cover the corroded virus. So you get an increase in your antibodies, but there's no virus involved in it.
I have a response from Aries. What would you say to those who believe information being released that's not the full story? For example, the spike protein being cytotoxic, but what they fail to mention deliberately is that the protein spikes are not delivered in toxic quantities, and vaccinations help eliminate these toxins. Where should we look for more detailed and accurate information?
I'm not sure that I fully understand the question?
It involves spike proteins. There's a report or story that spike proteins are cytotoxic, and it doesn't mention that protein spikes are not delivered in toxic quantities in the vaccinations.
I'm not familiar with anything that the spike protein. I think it's a fairly small protein, and as far as being toxic in itself, I don't have any knowledge of it being toxic. So if there's something that it's causing, none of the reports that I've read mentioned it.
And then the second part of his question was, where can people look for more detailed or accurate information about vaccines?
I'd say the CDC website it's got all kinds of information, with aimed towards variants. It depends on how much detail you want to go into on the vaccines and the virus. So that would be the place that I would look. I mean, also the Arkansas Health Department, which is healthyarkansas.gov, has a variety of sources of information. It's in English and Spanish, and that's those would be two websites that I would suggest looking forward if you're looking for more information.
Linda on YouTube asked, "Are you comfortable eating in a restaurant?"
I am. I think yeah, I am. But I really try to see where other people, how close it is. I wouldn't be comfortable in going into a bar where there's a lot of people standing around and bunched up together in a restaurant where the tables are spread apart and the servers are wearing masks. I'm comfortable with that.
Speaking of masks, we have a question from Joe. If a mask is supposed to prevent you from giving the virus to others, why wear a mask to keep from catching it?
Well, when it was first came out with it, the early studies were showing that had shown, because they were looking at that to see how masks did as far as preventing the spread. But as it turned out, more studies were done, and which have borne out that it not only protects the other people around you, but it also protects you. And I think one real good example of that is the flu season. We essentially didn't have a flu season this year, and I think that many people attribute that to the fact that we were wearing masks and we were being protected from it. So I think that it's pretty clear from the studies that masks prevent the spread, but also prevent you from catching it.
Question from Barbara: is going to the Garland County Fair safe?
I think the recommendation is still, if you're outdoors and not and doing the social distancing, that would probably be safe outside the outdoor portion of it. I'd say that I'd be kind of concerned in the areas where they have the exhibits. I've seen those as the potential of being pretty crowded. So I would be less comfortable there, and I would suggest just wearing a mask, because there's a lot of people there that you don't know.
Ayers wanted to clarify. He had the question about the spike proteins in the vaccines. He said his question was basically asking about deliberate misinformation being passed as true scientific information. How do we distinguish which is truth?
Well, I think you have to look at your source, and again, I would say the official sources like the CDC and the health department. I would certainly trust those more than kind of general news stories or Facebook posts and things like that. So I would go to the official places that have well documented information. You got several experts that are looking at it before it gets posted.
All right. Well, that's all we have for live and emailed questions and comments right now. We had another one come in. Joe asks, what is the purpose of a mask if you have been vaccinated?
I'm sorry.
Joe asks, what is the purpose of a mask if you have been vaccinated?
Well, because the main cause is that it's shown that vaccinated people can catch the Delta variant, and we, even when vaccinated people do catch the Delta variant, they have the potential to spread that to other people. So that's the reason behind vaccinated people needing to wear the mask.
Speaking of the Delta variant or variants in general, should we be concerned about future variants? We've heard of Delta Plus and Epsilon and other potential variants.
Oh, definitely. That's what viruses do is they mutate, and the more virus that you have in the community, the more likely that that there will be a mutation that will be different and stronger or more contagious or do other things. So the only way to eliminate that is to eliminate the virus, and the way you do that is get everybody vaccinated.
Are you aware of any other variants that have been cited in Arkansas yet?
I know the alpha variant has been seen some in Arkansas. Again, since we aren't able to do the sequencing required to identify variants in state, I think our knowledge or experience is less. But I know that they have seen some other, at least a few cases of some other variants here in Arkansas.
All right. Well, Dr. Shelby, I want to thank you for your time today, and we are going to meet again Wednesday, August 18th, same time, 2 p.m. And we'll probably do this every 2 or 3 weeks as often as possible, have some more installments of this in September. So I want to give you an opportunity to give any final remarks you'd like to make to the viewers.
Okay, thank you, Paul. Well, I really appreciate Paul and the Garland County Library for facilitating this. I think the more information we can get out and just kind of communicate amongst each other about the concerns and the opportunities and the challenges ahead, I think all of that's very, very important for us to do, because we're all in this together, and we've got tools to mitigate and eventually eliminate this terrible pandemic that's unfortunately is making many of our citizens ill, and we have a significant death rate. I mean, we're up over 280 deaths here in Garland County, which is a significant number of losses. And so again, I encourage vaccinations. I think they're important, they're safe, and that's just the only way that we're going to be able to put an end to this.
All right. Well, thank you very much, Dr. Shelby. I'll see you here in a couple of weeks, and hope everyone tunes back into that one as well and come with as many questions as you have. Dr. Shelby will be glad to answer them.
Okay. Thank you.
Take care.
It was a pretty lively discussion.